Okay, let me begin. Hello, everyone. This is JB, Regional Sales Manager at ExcoBio. First of all, on behalf of ExcoBio, I'd like to thank all of you joining us today. We truly appreciate your time and your interest to our technology and our brand AAC Plus. So today's session is special rebroadcast of one of our most attended and highly requested webinars from last year. Due to the overwhelming response for practical communication strategy in daily clinical practice, we decided to bring this session back to you guys. This webinar consists of two lectures delivered by two speakers, each sharing practical insights and real-world experience on how to effectively explain exosome treatment to patients in a clear manner. In the original live session, we conducted a Q&A immediately after each lecture. For this rebroadcast, we are collecting your questions through the link provided in the chat. Since this is not a live session, all submitted questions will be forwarded to the respective speakers after the webinar, and their responses will be shared accordingly to your email. So we would appreciate for your understand that it might take some time. Now, without further delay, let us begin with the introduction of Dr. Jacqueline Luna from Philippines. Dr. Jacqueline is a dermatologist and the medical director of Bello Medical Group. Bello Medical Group is one of the most premium clinic chain, which has, as far as I know, 14 branches over the country, Philippines. We believe he is one of the most experienced doctor with our exosomes in Philippines. So again, welcome, doctor. You can now share your slide. Oh, we will share your slide, and once you say next, we can go to the next slide. Okay. So stage is yours. You can speak. You can start now.
Okay, thank you so much, James, for that introduction. There's a typhoon in the Philippines now, so I think it's safer that you are sharing my slides. Okay, so good evening from the Philippines. Today I'll be sharing some best practices on how to talk about exosome treatments with patients. Okay, next slide. I'm Dr. Jacqueline Luna. I'm a dermatologist with nearly 20 years experience. I maintain hospital practice and I also work with the Bello Medical Group. The Bello Group is the most innovative medical aesthetic clinic in the country. Next slide. As mentioned by James, we have 14 branches and maybe more than 60 doctors and surgeons. This is our latest clinic. It's called Bello Nexa, and we just celebrated our 35th anniversary last month. All right, next slide. Next slide. For tonight's lecture, I was assigned four key guide questions to frame our discussion. First is, how do you recommend and explain exosome treatments to patients? How do you incorporate exosomes in your clinic programs to make them more efficient, profitable, and boost patient satisfaction? Third, how did using exosomes change your practice? Okay, so to best address these questions, I've put together not just my own experience, but I also released a survey to other fellow exosome users here in the Philippines. Luckily, I had 30 doctor respondents who generously shared their perspectives on their use of exosomes. Okay, so next slide. First, when and in which cases do you recommend exosome treatments? Next slide. 100% of the 30 doctors said they use exosomes for skin rejuvenation and anti-aging, post-procedure healing, and usually that's after energy-based devices and lasers, and all of them also use it for hair loss. Okay, so 86% of the respondents also use exosomes on pigmentary disorders, melasma, acne, and acne scars. Then about 10 doctors said they use it for other indications, and these are the following. So next slide. Okay, so that's various forms of dermatitis: atopic dermatitis, seborrheic dermatitis, nummular and stasis dermatitis, rosacea, psoriasis, burns, wounds, striae, post-chemotherapy and post-radiation. So essentially, exosomes have become part of almost everything we do in our clinical setting. I think this evolved over the past 4 years through trial and error. We started using exosomes way back in 2021. Next slide. And our use of exosomes was further supported by research on skin quality attributes. And this slide shows you that you can't really address all patient concerns with just one modality. So as you can see in this image, skin quality is defined by three main attributes. So visual, topographical, and mechanical. Okay, so when you talk about visual attributes, these are what we immediately see, like pigmentation, redness, or glow. Okay, topographical features are those that we can both see and feel, such as texture, pores, and fine lines, coarse lines. Okay, and then third, mechanical attributes relate to how skin moves and behaves. So it's elasticity, firmness, and thickness. So these are actually the most common concerns of our patients in combination. And what's important to emphasize here is that there's no single treatment that can target all these dimensions at once. Like, for example, okay, lasers, for example, can improve pigmentation and texture, but they don't fully address elasticity, right? So RF microneedling can work on collagen and firmness, but not necessarily radiance. Okay? Topical medications or injectable treatments can boost hydration and glow, yet will not correct laxity on their own. So that's why in our practice in the biomedical group, we almost always combine treatments with exosomes as usually a key part of the approach. Okay, so that's how we evolved. Next slide, please. And these are some examples of skin tightening devices that we use in our practice. We have all of this in our clinic. Let's see if I can name them all. So that's Softwave, Liftera, Linear Firm, Thermage. We also have Zerf, that's dual monopolar RF. We also have Ulthera Prime. Virtual RF is RF microneedling, and Red Touch, that's a 675 nanometer laser. So all of those skin tightening devices can be combined with exosomes. Next slide. We also have our energy-based devices for skin pigmentation. So here from left to right, we have Photona Dynamis, that's Erbium. We have Revlight, Harmony, Pico Laser, and that's Photona Skywalker. Next slide. We also have all of those in our practice. And then my favorite devices are skin resurfacing devices. Our CO2 lasers, Silk Lace, Acupulse. We have Clear and Brilliant, that's a 1414 1927. We have Lace MD, and we have Fraxel. Okay, so this is actually my favorite gadgets to be combined with exosomes. Okay, next slide. And let's not forget our devices for acne and acne scars. I think in the Philippines, we're the only clinic that has a cure. That's a 1726 laser. We also have the Adva TX. That's a 589 3019. It's a yellow laser. And we also use a lot of skin pen and turtle pin when we apply exosomes. Okay, next slide, please. And then in the Philippines, exosomes are only FDA approved as topical treatment, and we have been safely and effectively combining it with these products. So the one shown on the photo, that's Profilo, Skinviv, hyaluronic acid. We have InBioWhite, tranexamic acid, XDNA, PDRN. We have Regeran, polynucleotide. We have Betterfil, Yalupro, NCTF, amino acids, and various brands of toxins. Okay, so we do have a very extensive armamentarium of devices and products in our clinic. Next slide, please. And even in our social media posts, we make it a point to highlight and recommend treatment combinations that are proven safe and effective. So here are some examples. So we combine exosomes after doing Thermage, after doing fractional CO2 laser. Next slide, please. We combine it with Advalite 589 3019, or after RF microneedling. All right, next slide. Okay, so next, which patient profiles benefit most from exosomes in your experience? Okay, so most of the doctors give it for patients with sensitive skin types, followed by middle-aged, those requiring correction and maintenance, and then mature skin, those requiring restorative and repair. Okay, and then lastly, some of our doctors also give it for younger patients, probably for rejuvenation. Okay, next slide. Okay, so are there any contraindications or patient situations where you avoid recommending exosomes? So our doctor said that they avoid giving exosomes to pregnant women, those with any kind of cancer, active infection, previous history of irritation, active acne. So I think those information adequately answers the first question, when and in which cases do you recommend exosomes? All right, next slide, please. Okay, so second question. How do you recommend and explain exosome treatments to patients? Okay, next slide. Majority of our doctors, 76%, said they use simplified analogy, like talking about exosomes as healing messengers or instructions for repair. Also, a significant percentage of doctors emphasize the visible benefits or results, like, for example, skin glow, faster recovery, or improved pigmentation and hair growth. And lastly, about 40% of our doctors include a scientific explanation about cell signaling, regenerative medicine, or messengers when appropriate. So it really depends on the kind of patient that you're seeing. Okay, next slide, please. Okay, so some patients, sometimes require objective evidence of improvement. So it's always helpful, I think, to familiarize yourself with the data provided by the company, Exocobio, making it easier to relay this information to patients. So sometimes, I mentioned about exosomes enhancing collagen synthesis, increasing elastin, and exosomes supporting fibroblast proliferation. So always be ready with your answers. But, majority of my patients, next slide, also asked to see actual clinical cases. So it's best to document your treatment outcomes using any available, skin analyzer in your clinic, so that you will be able to provide objective evidence alongside the data given by the company. So this makes it easier for us to communicate and demonstrate the real results to the patients. Okay, so like this subject, I think Quantificare, a skin analyzer, was used here. After 2 weeks, there was improved wrinkling as seen, and that's after one treatment. Next slide. Also, the same subject with improved evenness of skin. So when patients actually see that you have actual, previous patients improving from exosome treatment, then it'll be easier for them to also try it. Okay, next slide. Okay, so what are the most common patient concerns about exosomes? Patient concerns about exosomes, because I belong to a third world country, mainly include cost and value. Okay, so maybe 83% of our doctors said patients asked them about the price. Second would be effectiveness, or whether it will really work, the number of sessions needed, and safety issues such as, its origin, from which kind of stem cell, and the side effects. Okay, next slide. A common response to cost increase when patients tell me why is it expensive, I always, highlight the superior advantages of this brand, because we only use ASCE in our clinic, and it has an advanced processing technology. There's extensive research backing, there's patented methods, and there's continuous quality improvements, that set it apart from other exosome brands. So in that case, I'm justifying why the price is a little bit higher than all the other exosomes in my country. Okay, next slide. And then when asked about effectiveness, I also often emphasize the presence of rigorous evidence-based clinical trials on efficacy and safety that's not available from other exosome companies. So this actually reinforces the brand's credibility and reliability. Okay, next slide. And then adding to that clinical evidence, I also share from our own practice, like, for example, this one, we use the exosomes for various types of dermatitis, like leg eczema. Next slide. We use it for seborrheic dermatitis. Next slide, please, James. Okay, next slide. This is atopic dermatitis. Next slide. Stasis dermatitis. Okay, so it's always good to show patients, the success stories of the others. Okay, next slide. And then there are also a lot of clinical papers on exosomes being effective for skin brightening. And we follow this with clinical evidence, or actual clinical evidence. Next slide. Exosomes has been proven by many of our aesthetic doctors to be effective for melasma. So here are just some photos shared by my colleagues with me. So in our setting, we see a lot of melasma, and we all know how difficult treatment can be. There's no single modality that's 100% permanently effective for melasma. Okay, next slide. another patient with melasma, next slide, and another one with melasma. Right? But so you can see the before and after results when we combine exosomes with our energy-based devices. All right, next slide. Okay, third, how do you incorporate exosomes to your clinic programs and make it more efficient, profitable, and boost patient satisfaction? So next slide. Which procedures do you most often combine with exosomes? Well, to answer that, first, let's see which procedures do we combine. 100% of our doctors surveyed said they use exosomes after lasers and energy-based devices. And 40% of our doctors said they'd also apply exosomes after injectable treatments and even as standalone treatment. Okay, next slide. So here are just some examples of before and after photos of pigment laser combined with RF microneedling and then exosome application after. And this was shared by one of our doctors. Next slide. We have also applied exosomes following CO2 laser removal of keloidal scars, and this is on the ear. And the purpose is to support and enhance, the healing process. Okay, next slide. We've also used it effectively as monotherapy for hair loss. That's telogen effluvium. Next slide. And this is androgenetic alopecia. We combined Regenera, that's autologous micrograft technology, with one session of exosomes on the same treatment day. Next slide. Okay, so in our clinics, we incorporate exosomes by combining them with almost all the procedures that we do. This not only enhances the treatment outcome and patient satisfaction, but also it makes our programs more efficient and profitable since, patients see faster recovery, better results, and are more likely to come back for repeat or complementary treatments. Okay, next slide. Okay, so how do you typically position exosomes in your clinic programs? Okay, so in our clinic programs or in our bundled services, we position exosomes in three main ways. Okay, so first, as an add-on to boost procedure outcomes and sales. Second, as a recovery or maintenance option. And third, as a premium standalone treatment, as mentioned by 20% of our doctors surveyed. Okay, next slide. Okay, so significant overall brightening with pigment laser and exosomes. Next slide. It also works well as part of the recovery process after chemical peeling. We all know that, chemical peel redness is expected after the procedure, but, application of exosomes immediately after, hastens the recovery process. Next slide. Also part of post-care after RF microneedling. Okay, next slide. Okay, so how has incorporating exosomes affected your clinic workflow? So in terms of clinic flow, exosomes contribute to faster recovery, shorter downtime, according to the majority of our doctors, that's 86%. Also, exosomes have minimal impact on procedure time and add very little complexity in terms of preparation. That means it's not, a significant hassle when you need to apply exosomes after a procedure. And only 1% said that it adds complexity to the procedure. Well, probably because in our setting, we have, our physician assistants to prepare the exosomes in our behalf, and they just give it to us when we need to apply them already. All right, next slide. Okay, so what is the impact of exosome use on your practice? Next slide. With all the advantages mentioned, when combined with other procedures and there's minimal disruption to clinic flow, it's really no surprise that exosomes significantly increase patient satisfaction. Okay, next slide. And how has exosome use impact practice financially? So I think this positive experience of patients not only strengthens trust and loyalty, but also it encourages patients to come back and recommend treatments to others, therefore having a positive impact financially. So that's the shared sentiment of majority of the surveyed doctors. Okay, next slide. Okay, so the positive impact is clearly reflected in the exponential rise of exosome use for both skin and hair treatments from 2021 to 2025. Next slide. As you can see here, we have consumed about 33,859 boxes of exosomes, okay, in the past 4 years. It entered the Philippines around the latter part of 2021, and as you can see, even during the pandemic, there has been an increasing trend in the use of exosomes. Okay, next slide. Okay, does offering exosomes strengthen Bello's reputation as a leader in innovation? That's Dr. Vicky Bello, by the way. Next slide. Okay, majority of the doctors, agreed to that. It was actually Bello that first brought exosomes to the Philippines, and just like with so many other technologies over the past 3 decades, we've always been at the forefront of pioneering new devices and treatments that eventually, become industry standards. Okay, because right now in the Philippines, there's so many brands already, like more than 20 different brands of exosomes. Okay, next slide. Okay, so I think this is my last slide. In conclusion, I think I was able to summarize the answers to 3 questions given to me. How do you recommend and explain exosome treatments to patients? You can explain it in 3 different ways. Either you just simply explain how they work, emphasize the benefit, or you can mention scientific literature. Second, how do you incorporate exosome into your clinic programs and make it more efficient, profitable, and boost patient satisfaction? I think, in summary, that's clinic integration. You combine it, bundle it with the other procedures that you have, by doing trial and error. And third, how did using exosomes change your practice? The practice impact, definitely it expanded our treatment options and built stronger patient trust through consistent and high quality results. All right, next slide. All right, that's Pia Wurtzbach. That's the 2015 Miss Universe, and she is our ASCE Exosomes Ambassador in the Philippines. Okay, so I think that's it for my presentation, and I think the floor is now open for questions.
Okay. Thank you so much, Dr. Jacqueline. It was, wow, really informative, helpful lecture, not only to the audience, and actually for us also. So, okay, here we have got some questions for you. Let me check. Okay. A question from Indonesia. The question is that we already knew how good use exosome, but more than our patient can handle the pain. Any trick and suggest to make patient more comfortable? We all know, yeah, it is. We all know our exosome cannot be injected as a law. We always recommending topical use. But can you answer to this question, Dr. Jacqueline, maybe?
All right, so the application itself should not be painful if you use, depends on the device. Like, if we apply exosomes after energy-based devices or lasers like microneedling, a cure, of course, you would need topical anesthetic, right? You do your laser and then you apply your exosomes immediately after. Then, usually, that's painless. Also, we use skin pen. It's a portable microneedling device. We also use turtle pin at a depth of about 0.5 millimeters. And in my experience, even without topical anesthetic, it's really bearable for the patients.
Thank you so much. Let me ask you a second question from Australia. Is exosome good with just simple microneedling device like Dr. Pen, for example?
That's right. I think I showed a lot of examples, combining lasers with RF microneedling, and application of exosomes after. I think it does work. Yes. And we do have a lot of patients doing that.
Thank you. Okay, third question from United Arab Emirates, UAE. Do we use exosome and chemical pills on the same session? Can we do that?
I think I showed one photo of that. It's not routinely used because you have to have channels for exosomes to enter. But then when we get complications from the peel, like significant redness or erythema or swelling, we do apply it so the patients don't panic. Yes.
Thank you. Wow, a lot of questions are coming in. So let me try to handle just 3 more, just shortly. So another question from Indonesia: can we combine tranexamine acid injection with microneedling exosome on the same time? Which one should be first?
Yes, we do that. I think that's one of the injectable products that I showed. We're using in BioY, tranexamic acid, and that's injected intradermally. That first, we put topical anesthetic. We do intradermal injection of tranexamic acid, and then you could use turtle pin. Turtle pin is that device with zero point 0.5 millimeter needles immediately after.
Okay. So maybe the last question from Slovakia. Wonderful presentation, doctor. And my question would be, in which age do you recommend them safely? Also in combination for Ordoskent as part of acne therapy? Thank you.
James, I'm sorry, I lost your last 10 seconds. What did you ask again?
Oh, my question would be in which age do you recommend them safely? Also in combination for Ordoskent as part of acne therapy?
Okay, for the age group, I think I presented a while ago that most of us give it for mature skin, those that need correction and maintenance, and even for the older skin. But I also mentioned that some of our doctors even give it for younger skin. So I think it's really part of their prejuvenation process, although that's not very common. Out of my 30 surveyed doctors, I think only 10% said they use it for young patients. It's quite expensive here in the Philippines. That's why um, most of us use it for mature skin. For acne, we use it in combination with our other devices for acne. We have the Accure laser for acne. We do facial, and then we do extractions, we do injections with steroid injections, and then we follow it with exosomes at the end. So it's usually always exosomes at the end.
Mm. Okay, thank you so much. We have so lots of questions at the behind, but due to the time limitation, let's please invite our next speaker. The remaining question, please share it with your local distributor so that we can answer properly. Okay. So thank you again, Dr. Jacqueline.
Thank you, everyone, for listening.
Okay, finally, now let me invite Dr. Ali from Saudi Arabia. Dr. Ali, a German board dermatologist, head of Majestic Clinic in Riyadh, one of the biggest and luxurious clinic in Saudi Arabia. He has been using more than 8,000 units of AAC exosome, which is the biggest quantity as far as I know. And Dr. Ali, let me invite Dr. Ali. So, Dr. Ali, can you speak? 마이크 켜줄 수 있어요?
Hello, are you hearing me now?
Yes, we do hear you.
I think it's still afternoon or evening in your country, so good day in general. Thank you so much, Ex-Cobayo, and especially for UGB and Ms. Kim for the invitation for this lecture. Thank you for all the participants there. I'm seeing now it's more than 200 people joining our seminar. It's mean that the ASCII exosome is become the best exosome as we are working before. So thank you for all participants. Thank you for my colleague, Dr. Loana. And it was informative presentation, and she had a lot for us all. And I would like just to inform all participants that we are international speakers that are working together in one team. Ex-Cobayo joined all together to work in one team to find a new indication, to do a case report, to do case study, and to share all experience to find all possible indication or side effect, and we solve all problems. So thank you, Ex-Cobayo, again, that you give us those chance to help our doctor and our patients. So how can I share my presentation now?
There will be a sharing button at the bottom as
okay,
a
and
green
this
color.
one, right?
Yeah.
So now it's sharing, right?
Yes, you can press slideshow button at the bottom.
Good. And now it's coming or not yet? Try that. Before I starting my presentation, I can only add some information about some question that you mentioned before. GB, regarding the peeling, I prefer to apply the mask after the peeling. Don't use the pure exosome because the alteration of the biology of the exosome will be altered by the peeling. So I prefer to apply the mask because we are lucky we have topical or we have mask from Excobio ASCII exosome, so we can use it as aftercare after the peeling. So this is only one comment. So I'll proceed for my presentation. Actually, this is special presentation regarding the patient communications. So can you move the slide?
Actually, you can move. Oh,
Yes.
okay.
As you know, our skin will be destroyed by microinjury, ultraviolet B, skin disease, toxin, and pollution, and aging as well. So we have to look for any solution to solve those problems. So all of our patients, they are coming looking for wound repair, anti-aging, and treat the hyperpigmentation and treat the hair loss. So how can we solve those problems? So we started to replace what we lost, and we trying after that to repair. And in the last years, we find the regenerative medicine which regenerate the skin cells. And this is what we find from the ASCII exosome. So the exosome, first of my presentation, to communicate with our patient, we have to understand the theory about exosome, and after that we become confident to answer our question. So you know the exosome is the small, tiny, nano-sized extracellular vesicles which communicate between the cells. The good thing that has high stability and non-immune rejection and direct stimulation of the targeting cells. So as you see in this picture, this is the nucleus with pink color, and the green color, this is the exosome. So it's coming from the nucleus and directed to the cytoplasm, and the cells that you see here with red color, this is the fibroblast cells. So we have a lot of indication for exosome, so we have to have it by our heart, we can use it for burn injury, psoriasis, scleroderma, diabetic ulcer, scars, ultraviolet injury, and also skin aging. And we use it also as drug delivery for skin cancer. And we still find a lot of new indication. The other thing we have to understand also the exosome efficacy in the regenerative medicine and pathophysiology for that. So it work as promoting tissue repair and regeneration, anti-inflammatory properties, and immune modulation. According to those 3 points, we can find our indication, and I will explain it in the next slide. Also, their cargo, it can stimulate the new tissue growth and reduce scar formation and modulate the immune response to promote wound healing or any inflammatory skin disease. Good. So we find a lot of indication. At the beginning of the Excobio starting to find the exosome, they treated the atopic dermatitis, and after that we started to find a new indication like psoriasis, systemic sclerosis, pigmentation, vitiligo, hair loss, cutaneous lupus, a lot of things that you will find it in my slides. So actually, as doctor, to discuss it with other doctors, for example, or other scientific people or patients, if they came to our clinic, we have to understand the pathways which play a big role for the exosome work. We have to understand the TGF-beta pathway, the effect of exosome in extracellular matrix, Wnt and beta-catenin pathways, and the effect of exosome in hair follicle and hair cycles. All of those pathways ways. If we understand it, we can answer all questions. I can describe all of those one in other lecture because our theme today is different, but I present all of those details in different conferences. So now our goal for this lecture is patient communications. So we have to educate the patient simply. What is the exosome? We have to clear that for them. At the beginning of our medical or before the medical school, actually we thought that exosome is only microphysicals that carry the trash from the nucleus to the cytoplasm and extract it outside the cells. But with the time we find it wrong, so we find it's the treating or ambulance car carrying the all amino acids and benefit from the nucleus to the other cells. And also it's a golden car or money car or bank car that's carrying all important material and amino acids that help to repair the cells. So as I mentioned before, every indication has also pathophysiology and also cause or any reason to find those indications. For scar removal, we have a lot of receptors and also interleukins for skin rejuvenation, for pigmentation and hair growth. So if the patient coming to you and ask, you are very expensive, why you use this exosome, why you didn't use other company, because we find also another exosome in the neighbor clinic with half of the price. You have to tell them and educate them. And even if the other company coming to your clinic, you have to ask them those 5 questions to tell them and to how do you understand the exosome and also to get the benefit. Maybe they have something new, so we have to ask them exosome source. You know that we have a lot of different sources, human, plant, and even animals, and even from the animals and human we have all adipose tissue, we have mesenchymal, we have a lot of sources, so we have to ask about the source. Number 2, isolation is very important. The isolation is very important. How can they isolate the exosome? And I will explain for you next time with the our next slide how, because we find now a new trend, the blood exosome. Did they can isolate the exosome only if they are shaking the blood in 2 tubes? So how can they isolate it? And this is a very difficult and complicated process. And exosome concentration. And this is very important because we find some clinic, they sales the exosome with number of ml. Actually are looking about the number of exosome, not the ml, because I can dilute the exosome file in 100 cc normal saline, but how many number of exosome that I have in those quantity? So the number, it's mean concentration, it's reflect also the efficacy. So after that, we'll shift to question number 4, exosome purification. It's very important. A lot of side effects is coming from poor and very bad exosome that they didn't analyze it very well, and they have a lot of debris that affect the result. Number 5, the efficacy, and this is my job and your job and the ExcoBio job. We have to look for the efficacy among our cases, and we published a lot of cases with different publications, and we shared a lot with a lot of cases every year. We have RAIS conference in South Korea, and it's done by ExcoBio. We share a lot of new indication, a lot of new experience. So we have in our backbone a good company that help us to share a new indication and cases so we can see the efficacy. So I'll shift to the next slide. We are lucky. The ExcoBio, they are the first exosome company in the medical institute, and they are the ones starting to build this idea. And with time, they built for us exosome for the skin, exosome for the intimate, exosome for hair, and also they find for us topical exosome as cream, daily used, or mask that can we apply it after any procedure. So this is very important to share it with your followers in your website or Instagram or with your patient. This company, it's expensive, you know that, but why? Because it's very pure and excellent product. They have right to become expensive because they did a lot of investigation and a lot of analysis, a lot of researches. They spent almost till now more than $80 million for their as investment for to produce those exosomes. Also, they have a big manufacturer. I visited 2 times, and every structure is built in high KPI standards. They have a lot of publication. Now we reach more 51, and also I will publish next week one case more. So we are continuing to build a new case reports and publication. We use the more than 2-3 million clinical cases among the world. I use more than 8,000 files. So a lot of cases with a lot of experience without any side effect. And also they have 4 master cell bank. And they are special that they make a real lyophilization. You can find another company, and I discuss another company that they told me we are like Excubio. We have lyophilization process, and when I check with them, they only make the material dry through simple process, which is it's not stabilization, it's only marketing. So those all points can help us to communicate with our patient and tell them the truth and comparison between your product and other company. So purification is very important. All of the company, they make the exosome only in conditioned media, and after that they give it to you in file. But the Excubio, they did it in 3 stages. Conditioned media, then first filtration and second filtration, which is very complicated and accurate process. And I saw all of that in their laboratory and manufacture. So next, exosome can cause cancer. We have a lot of questions like that, and unfortunately the social media now is easy for everybody to talk. The answer for this question, number 1, we use exosome to treat cancer. How can we, or how can the exosome cure cancer? Number 1. Number 2, the Nobel Prize for 2024 give us a new idea that we have microRNA, which is different from messenger RNA. And you can read what I find in the Nobel Committee for Physiology or Medicine. Those 2 guys, they explore the microRNA, and what they find, the flow of genetic information from DNA to messenger RNA to proteins, the identical genes information is stored in DNA of all cells in our body. This requires precise regulation of gene activity so that only the correct set of gene is active in each specific cell types. So it's not easy to take the cancer through the exosome and put it in patient body, because it's complicated process. And even if we have pure process to analyze and take the exosome, 100% will become clear. So even this new microRNA, it's help us also to find the background, because we find sometime a new indication, but we didn't know what's the background. And those microRNA help us to know how does it work. So thanks for those scientists to find the microRNA. So next. even in our in the XCOBIO team, they find also a lot of different genes and a lot of microRNA that they find it especially in their oxosome, and that help for a lot of different indication, anti-scarring, also anagenesis and anti-inflammation. So this is the important thing, because you'll find patient, they ask you, doctor, I would like to have autologous exosome in my body. I don't like to use any exosome from other body. This is what this is the one of the common question. And they said, we find companies that produce exosome through the blood. And the XCOBIO, under their electron microscope, we share also this this slide with all doctors and all conferences. And the left side, this is our exosome from XCOBIO. And you see the circle in the left side, upper left side. If you like to find a structure exosome, you have to have a lipophilic circle around the exosome inside. And this is the real exosome for content. But what we find in blood exosome, we find under microscope, the exosome is only about 0.5% of exosome, and the rest is lipoproteins, which do nothing. So the efficacy is almost nothing. So it's almost the result is like the PRP and the or normal plasma. And also we test the exosome, effect of exosome on our scar, and we take skin biopsy. And you can see here the different here control. This is normal scar. We use hyaluronic acid, and in the right side we take skin biopsy after session of XCO or ASCII exosome, and you can see the remodeling for all cell layers and precutaneous cells. So we change and remodeling the cells and skin layer. I will move fast. So now, if I would like to, and also the patient will ask you, how can you deliver the exosome? Why I can use the exosome at home as topical? No, we have to tell them we need channel. So we have to use drug delivery system like CO2 laser, like microneedling radiofrequency, dermapen, stamping. So we use it, and we'll make small channels to pass through the skin layers. Actually, with ASCII exosome, we pass all expectations. So I find a lot of indication. I will start from right side, androgenic alopecia. After 4 sessions, I find the result like hair transplantation. And female pattern androgenic alopecia here, you'll see a big difference, and also the hair color was changed. Here acne scar with subcision and CO2 laser, amazing result. In the last one, the patient with traumatic over the lips, and you know this area, it's very difficult to be healed. With ASCII exosome, I get almost 90%, 99% improvement. Post-abdominoplasty scar, post-brachoplasty scar, improvement, totally improvement with pigmentation, with the scar. Also the darkness under eyes, puppy eyes, and also brachoplasty here with mild hyperatrophy. So a lot of indication, and I have thousands of those cases. But with time, I find this one is almost like cosmetic issue. So I go deeper to find another indication. So I had patient in my clinic admitted as DRISS syndrome, and he was crying and scary about the scars. And after application of ASCII exosome with gauze, with every other day, the result is coming like that. And I started to treat him with the CO2 laser and ASCII exosome, and the update will coming soon. This patient, she has breast mastopexy, and she developed bioderma gangrenosum, and you know it's difficult disease with painful, and the healing is almost need years. And this result with CO2 laser after 4 sessions is completely healed with good scar. This patient, leishmaniasis, this is my friend, and he came to me, he asked me for cryotherapy. I told him, please, you are my friend, let me to try with you a new generation of medicine. And they talked skin biopsy, and you can see the Leishmaniasis is clear in the histopathology after stain, and I treat him with CO2 laser and oxazome, and the result amazing after after one session. So it can work also against infection, and also the pain it was acceptable, and the scars result was amazing. So next, I tried also for vitiligo, as I mentioned before. I used for this area in the middle, the big lesion, left side, the big lesion, I used oxazome with tacrolimus, and the other lesion I used the tacrolimus alone, and after 4 sessions with drug delivery system, they completely repigmented. Again, here for active acne, like Dr. Lona mentioned before, I use it for all active acne. I didn't use now Roacutan almost maybe 1% of my patient, because when I try it with my patient, I find excellent result, and I will avoid even the scarring. So you can use it for any age. Next, this is discoid lupus, active hair, and after 3 sessions, completely resolved. Again, tractional alopecia, new indication, and after 4 sessions, completely resolved. Here, lichen planus, pilopilaris, as you see the inflammation here and redness. The photo, it was not clear because the patient, he's the one sending me the pictures. And after 1 session, actually, the inflammation is almost gone. Again, this patient has alopecia areata, and we published a lot of cases of alopecia areata. This patient has allergy from steroids, so I didn't find any solution rather than the oxazome hair. So I used for him multi-sessions, and the result, as you see here, is excellent. And the last photo, I didn't get it, but actually it's completely resolved. Old burn and pigmentation, and after 4 sessions with CO2 laser combined with pico laser and oxazome, almost completely resolved. Hypertrophic scar, I combined it with also the Conacort. So you will avoid here the side effect of Conacort, so and CO2 laser. So the result is amazing with low side effect of Conacort, and we can regenerate the skin at the same time. If you trust the material, you have to use it for yourself. And this is my scalp, and I use the oxazome hair for myself. So in the left side before treatment, and the right side after 4 sessions. So I trust the material, so I try it for myself, and I get the result. Thank you so much for your concentration, and I'm happy to be with you.
Thank you so much for your informative lecture, Dr. Ali. It was really helpful to the doctors who are thinking to try our products more and increase their amount of consumption in their clinic. Thank you so much. And also, we have some questions for you from the audience. Let me check. A question came from Cyprus. What is the profile of the ideal patient for exosome-based treatments? In which cases would you recommend choosing another type of treatment instead of exosome? So he is basically asking the ideal patient for exosome treatment and contraindication.
Actually, you have to evaluate your patient first. But what I prefer for the oxazome all the time to combine treatment. Don't use, even in our practice, I will not use, for example, filler alone. For cosmetic issue, I try to combine to do face analysis, and I combined with other filler, Botox, collagen stimulator, anything. Even for the hair, for example, I can use for the patient oxazome and minoxidil. I can use microneedling and oxazome. I can use, for example, Regenera or PRP and oxazome, or I can use it depend on. So it's depend on your case. Because our lecture now is about the oxazome, so I would like just to inform you how the oxazome can do a lot of things that can help. Number one. Number two, the contraindication. Actually, I don't prefer to use oxazome for pregnant patient, this is the only thing, or the patient that she has a lot of allergy, so I'd like to do prick test, for example, to examine my patient before starting the treatment, rather than everything will be safe. As my colleague Luana mentioned in her presentation, all the time we prefer to use topical with drug delivery system.
Thank you so much. Another question came from Greece. What are the depth of microneedling with exosome for acne scar and vitiligo, if not using lasers?
Perfect. Good question. Depend on the area. For example, for the face, I prefer to go till 2 to 2.5, so deeper to reach the lower space. But if I have hypertrophic scar, I have to go more deeper and deeper. For example, for the wide pores, I will use 0.5 to 1 mm. For example, for the vitiligo, I prefer to use fine and one pass, because you know the also deep trauma can activate the vitiligo. So be gentle with the vitiligo cases. You can use 0.8. This is the only one that you have to be gentle, but the other one you can go aggressive.
Thank you so much. Actually, so many questions are now coming in, so let me go fast. Another question came from Indonesia. How many times the scar can be better when used exosome?
Actually, the standard my standard protocol, I have to do 4 sessions, and after that, every month 1 session. So 4 sessions total, and after that, I will do the evaluation after the 4th session. Depend on I can change or manage my pathway, or I can continue. But as more as possible, you will get better result.
Okay. So another question from Malaysia. Regarding the active acne patient, how many sessions do you recommend with ASC, and what are the intervals?
Actually, I did for my patient every 3 weeks, and you will see the improvement after the first session. All of my patients, I see the improvement after 1 session. And what I give the patient also, Exobalm, the topical, I give it to the patient at home to use it at home as well.
Okay.
Another also good thing, you can also combine it with systemic antibiotic if you have cystic acne and the patient under pain, so you can combine it with oral antibiotic.
Okay, we have a question from Poland. What is your most frequent protocol for androgenic alopecia? About session, how many sessions and interval?
Excellent question. I did 4 sessions monthly, and after that, stationary or controlled session every 2 months. So the first 4 months monthly, then I'll give the patient 1 session every 2 months.
Okay, another question from Malaysia. Dr. Ali, thanks for your great presentation. When you deal with scar combined with exosome, you prefer RF microneedling or CO2 laser?
I love my CO2 laser, so I prefer the CO2 laser, and you have to start the treatment after 1 month of the scars healing. But I prefer CO2 laser, and even in your Asia country, you have skin type 1, 2, 3. So you are lucky that you will not develop any post-inflammatory hyperpigmentation. So I prefer CO2 laser.
Okay, thank you so much. Maybe this would be the last question from Australia. How do you discuss expectations and the number of sessions with patients given the high price of exosome?
Perfect. This is also a communicating question. We'll tell the patients that we have a good product. And even if you buy a car like Mercedes-Benz, it's not like, for example, let me to say, I don't like to mention another one, to maybe some of the audience has relative,
Okay.
but if I buy, for example, Mercedes-Benz or a Ferrari, it's not like the cheaper car. So the efficacies depend on that. I can use also even in filler. I can use a filler which costed $100 and one costed $10. So this is the price. It means quality. This is number one. Number two, the sessions we need almost normally 4 sessions. And as I inform you, trust me, I used huge number of the exosome. I didn't find any complaint from the patient, all of them happy. But in the first session, you can tell the patient in the first session, she will not see a lot of changes. Maybe she will see 20 to 30%. But after the plan, the end plan treatment, she will see at least 80% improvement.
Wow. Okay, thank you everyone. This is the end of today's rebroadcasting webinar. If you have any question, please feel free to leave your questions through this link, also in the chat. As I mentioned, it will take some time to have answers from the speakers today. Thank you again for your joining and hope you have a great day ahead. Bye-bye.